Afternoon. So I have to share with you a story before I start. This morning I got on a social media platform, one of those that connects people with business, and it had a recommended job for me. And the recommended job was the deli clerk at my local supermarket. So I hope that's not an indication of how this afternoon is going to go, and that tomorrow I'll be at the deli clerk application. So. Thank you for sticking with us this afternoon. The slides, I want to just mention that the slides were updated for this presentation. So you'll notice 3 or 4 slides that have a minor change in them, and I will highlight the information that's been updated when we get to those. We are going to be talking, and I say we, my colleague Julie is on the phone. When we go through this last session together, our hope here is that you'll be supported with data submission and also using the reports that CMS makes available to providers in home health. So I'd like to ask you guys a few questions before we get started. My first question is, who in this room is involved in actually submitting, so uploading the OASIS files? I see 5, 6, 7 hands. Okay. Who is involved in going in and actually pulling out the reports? So getting those reports and pulling them down and making them available to your colleagues. Okay. And who looks at the reports? Who's involved in looking at and evaluating the reports? Maybe involved in the QA team or quality improvement team where you're looking at those together and looking at how your outcomes and different measures are stacking up. Okay. So hopefully you'll find this session helpful for you to understand how you can better meet the quality reporting requirements. So let's start by taking a look at the objectives. It's my hope at the end of this session that you'll be able to identify strategies that will help you be more successful with submitting your OASIS records, and that you'll just be able to describe how you'll navigate the Certification and Survey Provider Enhanced Reports, or CASPR reporting application, and that you'll be comfortable with talking about using the final validations reports, with identifying what the purpose of those reports is, how you find them, and importantly, what you do with those common errors that come back in those reports. We will talk about the top 10 errors from the OASIS submission, and importantly, I hope that you'll understand how you'll know what to do about those errors. The error codes come back to you, and it's really about the investigation and the action on those that's the most important use of those codes. Excuse me. We'll talk about a lot of other reports that are available through CASPR and other sources to you all. And then finally, we'll wrap up with a few resources that you'll hopefully be familiar with. So let's begin with some basic tips about submitting those OASIS records. You're going to be submitting these into the Assessment Submission and Processing System, or ASAP system. So you'll hear if someone's talking about ASAP. So in order to do this, first you want to ensure that you have the CMS Net user ID and password, and that the Juniper communication software has been correctly installed on whatever computer it is that you'll be using. This allows you to connect to the CMS private network. Next, you're going to ensure that you have registered for and activated your Quality Improvement and Evaluation System, or QEES, user ID. And this ID allows you access to both the QEES system and to the CASPR reporting application. Each agency is allowed to have 2 user IDs, so 2 CMS Net user IDs and 2 QEES user IDs. Information about how to obtain those user IDs is available on the QTSO website. So the QTSO website is www.qtso.com. When you go there on the web page, on the left-hand side, you'll see a place where you can click on OASIS, and then up at the top, there'll be lots of options for you to select the different resources that have been made available to you there. So do check out that website if you're not familiar with it. There's a wealth of information, excuse me, including a couple of users' guides that I think you'll find really helpful. Next, your organization must use data entry software that's capable of formatting the OASIS records in an XML format and exporting those files in accordance with the data specifications that have been created and made available by CMS. These OASIS data specifications are available on the CMS website, and the link to those is shown there on your slide. And then finally, before you submit, ensure that the facility ID that you've received when you've registered your KEYS user ID is correctly entered into your, the software that you're using to enter those OASIS records. If any of these steps haven't been successfully completed, you're not going to attempt to submit those records. And OASIS records are submitted into the KEYS ASAP system via the OASIS submissions system, and you'll see the link for that on the Welcome to CMS KEYS Systems for Providers webpage. And we'll have a screenshot of that webpage in just a couple of minutes. In addition to seeing the link to where you can submit those records on that webpage, you'll see several other files. We'll talk about each of those in just a little bit. But I do want to mention one, and that's the KEYS user maintenance application that's available there. And this is an application that allows you access to reset passwords and to perform other account maintenance. When you access this system, you'll log in using your KEYS user ID, and then use your user ID and password, and then upload your files that do contain your OASIS records. After uploading the records, you'll see an online initial confirmation message that indicates important information about that submission. Included in that message is the submission ID. And that submission ID is a unique identifier that's been assigned to that file that will allow you to identify that file in some subsequent steps when we're looking at the validation reports in particular. So that is assigned by the system as you upload those. Be sure to print out this initial confirmation message that's made available there, and we will, again, talk about that when talking about those final validation reports. The OASIS Submission User's Guide is available via a link from that welcome page. And in the guide, you'll find information about the submission of OASIS data. And again, the link to QTSO is right there, that qtso.com website. And the next slide here shows a screenshot of the welcome page. And there's several features, and we'll just kind of walk down through them quickly in the order in which they appear. The first is the OASIS user registration. And this is a self-service user registration tool with which the provider can register for a user account. They can to access the OASIS submission system and the CASPA reporting application. Then there's the spot right by the blue and black little key, and that's the OASIS submission, and that's where you actually log in to access to submit those assessments. Next, you'll see the CASPA reporting, and that's the login page for the CASPA reporting application through which you can obtain several reports that we'll talk about later in this presentation. The KEYS user maintenance application that I mentioned is listed there. There's also a user's guide for that maintenance application, and the final link there is to the OASIS forms themselves. So now, let's imagine that you've submitted your OASIS forms, and now you've submitted those files, and next you want to make sure they were accepted. So being submitted doesn't mean submitted and accepted, and that's really where these validation reports come in. These validation reports that we're going to talk about, and we're going to spend several minutes talking about these. They can really help you to understand whether your your reports have been accepted, but also if they have been accepted, if there's potential issues that you want to investigate those. So when you access your reports, those and other reports are going to be accessed all through the Casper reporting application. As I mentioned, a link to this reporting application is available on the Welcome to CMS Keys for Providers webpage, and you'll log in there using that Keys user ID and password. Ooh. Sorry about that. Excuse me. So the final validation report is a system-generated report that's generated within 24 hours of the submission of the files that contain your OASIS records. It's generally made available much sooner than that 24 hours, and it provides feedback about each individual record that's been included in the submission. A final validation report will be created for that file of records if the provider that's been listed in that file is identifiable. If there's no final validation report, it means there was a serious problem with that file, and we'll talk about what those specifics of those are. So available final validation reports are automatically placed in your shared provider VR folder, validation report folder, and that's a read-only folder that's available to you in the system. This is one of 3 permanent folders that are available, and it can be accessed by anyone at the agency that you're submitting on behalf of who can also submit data. The other 2 permanent files that are available include My Inbox, and that's where if a user is requesting particular reports, those reports will be made available in that My Inbox. And there's also a shared provider folder, and that's where agency-level automatically generated reports are going to be stored. Shared folders can't be changed. However, there are options for you to customize your folders that are available to you in the Casper reporting tool. For instance, you can create additional folders if you choose to through the Casper maintenance page, and you can find more information about this in Chapter 2 of your Casper Reporting Users Manual. And that's a manual that I just want to highlight to you. There's tons of information in that, and you can find it on the QTSO website. So Casper Reporting Users Manual. And there's 2 types of validation reports that are available to home health agencies in the Casper reporting application. The one we're going to focus on the most is that system-generated final validation report that I mentioned. The other is called the submitter final validation report, and it's not automatically generated, but it can be requested if you identify severe errors. So this is when you haven't gotten that report back because something is so significant with that file that the system hasn't generated the final validation report. So let's talk about how to find those validation reports a bit. You'll select that VR folder name, and a list of the system-generated reports will display there. Using that submission ID that I mentioned in that initial confirmation, so when you initially submit, you get that initial confirmation back, you're going to use that submission ID mentioned earlier to locate that final validation report in the validation report folder. This slide provides an example of how those final validation reports are labeled. So they're labeled submission date and time, then a dot, and then the submission ID. So you see an example of a final validation report. Name there, 01/2016, 15/30/29.789541. And that's interpreted as the first 8 digits are the date, so July 1st, 2016. The next digits that appear there, 15/30/29, are the time. It was 3:30:29 in the afternoon. And then then there's that dot that separates the date and time from the submission ID, which are those final 6 digits. Each report name that appears like that is a link through which you can open and view the contents of that report. So there are two types of reports that are available. Oops, sorry about that. The first is the text formatted report. And this is the most user-friendly report, and it is the version that we're going to look at momentarily. And it's identified by a little notebook icon, looks like a little notebook alongside the final validation report name link. The other version is an XML format version, and this really is intended for software users, and that can be identified by the XML icon. And here's just a snapshot or screenshot of what the Casper folders page looks like. The folders available to you are listed on the left-hand side of the page. And in the center of the page, you'll notice that there are the links to the reports, and you'll see the little white page with the red icon that said XML, and then the little green and white notebook. Again, the green and white notebook is the text version, the more user-friendly version, and certainly the one I think that's going to be more useful to you as a provider. So let's take a look at a final validation report. You'll see in the top of the report in the header or upper portion, you'll notice the number of records that have been submitted. You'll see some basic information about the date and time, the submission ID, all of that type of information. And then you'll see the number of records that have been submitted. So when they're talking about a record, it's an OASIS record that have been processed, that have been accepted or rejected. And you'll also notice there's some other information about this submission, including the number of error messages. That's going to be noted up in that top. And then below that heading, so kind of below that dotted line in the body of the report, there's information about each record that's been included in the submission. Included here are going to be any error message. So let's talk a little bit about what those error messages mean. The first, we come to fatal file errors. And I kind of, as I have talked about this kind of file versus record error, think about the analogy I use for this is if you had interdepartmental mail and you had a whole bunch of little envelopes that were stuffed in one of those big giant manila envelopes, think about looking at the file as looking at the outer envelope. It's kind of making sure the whole package it kind of gets through. Then once that whole package gets through, each individual record is then going to be looked at that's inside. So those are kind of the letters that are inside that manila envelope, to go back to my analogy there. So, excuse me, each time that a user submits an OASIS file into the system, there's going to be 3 types of edits. And we start with that big one, kind of looking at the file. So it's the file structure being validated here to make sure that the format of that file meets CMS's requirements in the data submission specifications for the OASIS. If it doesn't, a fatal file error is going to be received and the file is rejected from the system. So examples of these types of file errors are that it's not a zip file at all, or that the records in the zip file can't be extracted, they can't be pulled out, the individual records can't be pulled out, or the file can't be read. This is where that submitter final validation report, that report that you have to request, comes in. This is where you're able to request that report, get information about what's wrong, and then correct what's wrong with that file and attempt to resubmit again. But if that file, the whole big manila envelope kind of goes through, then the individual files inside are going to be looked at. And they're going to be validated first for fatal record errors. So fatal record errors are going to be things that the system is going to reject that individual record and something's going to have to be fixed with it, and then it will be resubmitted. So types of errors that you might have here include out-of-range responses. For instance, the OASIS allowed an answer of 1, 2, or 3, but a 6 got in there somehow. That's going to reject it. That record's going to come back to you. It also could be inconsistent relationships with dates. For instance, a patient's birth date was listed as after their date of physician-ordered start of care. So it's something that just can't be. excuse me. So with a fatal record error, that individual record is rejected by the keys system. And the provider, so you or whoever's doing that submission, is going to be informed of these errors on that final validation report. So that's the automatic system-generated report that you get. And again, the rejected records need to be corrected or addressed and resubmitted. And the records are also validated for warnings. And warnings are non-fatal errors. These are going to include things like consistency items, again, ones that aren't fatal or critical in nature, and also missing or questionable data. Some examples here are going to be timing errors. So if you have an OASIS that's submitted greater than 30 days after the completion date, that's going to be an error message. Record sequencing errors are examples of warning messages, and this would be the start of care assessment has been submitted after a resumption of care. So they're still going to allow, its submission of those two things is still allowed in that order. It just doesn't make sense. It's not the order in which the system expects those records to be received. So with these warnings or non-fatal errors, it's really up to the provider to take a look to say, why did this happen? Is it accurate, right? First you're going to be saying, is this really the right answer, or is it really the right record, or whatever it is? And really do some investigation on the individual error, but also then look at them kind of across errors. So what do we have going on that we've got the same error 6 times in one submission, or the same error 4 times in the same week? So look at these from an individual issue of, do we need to do something different for this record? But I also think that warning messages in particular give you an opportunity to say what's not working quite right in our system, that we need to make some adjustments on a system level to make sure the OASIS are getting in on time, that we are submitting them in the order in which they're expected, things along that line. And as we look at the individual error messages, I think you're going to see that there's some big opportunities how systems may be able to be tightened up a little bit. And I think you might have some issues to put on your action plans there to say, is there something we could do a little different here? So final validation reports are going to be automatically deleted from your folder after 60 days. You can still request that OASIS submitter final validation report using that submission ID at any time. This is one slide that I want to point out to you. Differs a little bit from the initial ones that were posted a week or so ago. Anytime there's a fatal error, it does need to be addressed, and your OASIS records need to be submitted so that you comply with that 30-day time frame, right? Even if, and that's when I said to you at the beginning of this discussion about the final validation reports, that submitted doesn't mean submitted and accepted. You're submitting these, you're submitting them timely enough that you've got time to react to the errors that come back to you, right? If you submit it and something's wrong with the, on day 30, and something's wrong with the file, and it's not accepted, you haven't submitted on day 30, and now you're what? Late, right? So we want to make sure that your processes are such that you're allowing time to investigate and react to the error codes that are made available to you. So I have a polling question for you. And the polling question, hopefully you have your polling devices. And the polling question is, a final validation report is named 0125-2016 152-931.956214. Is referencing a file submitted on what date? Is it January 1st? 2016, January 25th, 2016, October 25th, 2016, or none of the above? And take just a moment and click that in. And if you were pressing before I turned on the poll, I apologize. Press again. I'll give you just a couple more seconds there. This is pretty heavy-duty stuff for the last session of the second day, huh? You guys are troopers for sticking with me. Thank you. Okay, 94% of you say that it is January 25th, and when we look at the file number, it's 01252016. So the 01 is the month, the 25 is the day, and the 2016 is the year. So at this time, I'm going to share with you the top 10 errors. And these are the top 10 errors based on data that was gathered about the end of September. So what you're seeing here for not only what are the top 10, but for the counts that are associated with the top 10, you're seeing information about 9-ish months of the year. So you really could add another third or so to these numbers to get an idea about how many come through in a year. So the number one error is 3330, records submitted late. And look at how often this error is received. Nearly 2 million through September. What do you guys think of that? Are you surprised? Are you saying, what are all those other providers doing because I'm never late? Did y'all just say that? What do you think if you're the one doing that Oasis, but the guy who's back at the office sending them in isn't sending it in on time? So you might want to check out on your, back at the ranch, how often this error is received at your agency. And again, the cause of this is exactly what it sounds like. It's submitted late. It's more than 30 days after the M0090, the assessment completed date. So what should happen if you get this error? What are you going to do? What do you think? Yeah. Some people went, what are you going to do, right? It's submitted late. So once in a while, if you get this, it's once in a while, right? Isolated incident, maybe something happened, maybe. But what if you're getting this several times a week? You've got a system issue, right? And that's the opportunity to look at these errors beyond one assessment. Look at them longitudinally across your agency and take a look at systems when it seems like it might be an issue. The next most common error occurred over 1 million times, and this is error 915, patient information mismatch. So what's happening here is based on patient matching criteria, and if you look in the user's guide where the information is about all of these errors, you can actually get the details of what patient matching criteria is. But it's things like last name, first name, middle initial, date of birth, things like that. So when you get this error, the information that you submitted is close enough to information that's already in the system for the patient that it's made a match, but something's not right. I mean, my first name is Jan, or Jen. Everybody in the world calls me Jan because they think it should have an A instead. So if you were assessing me and you wrote Jan Pettis instead of Jen Pettis, and then the next guy writes it correctly, the system's going to kick this error and say patient mismatch. It's still going to accept the record. Okay, so in this case, the one that said Jan Pettis was already in there. Now it says Jen Pettis. So the Jen is going to update it in the system. So as an individual who's submitting that record, now you're looking at that and saying, okay, did I just update it with correct info, or did I just update it with incorrect info? And if you just updated it with incorrect info, you're going in and modifying that information to make sure it's correct. Okay, and again, another example that may come through here, maybe you didn't have a particular number, like a social security number wasn't available to you initially, and now it is. So again, that's nothing wrong. You've updated it. It's the correct information, but you want to investigate that to figure out what caused that error to occur. Okay? The next one is duplicate assessment. And this is the third most common error. It's 907, and it is a fatal error. So this means that somebody submitted an assessment or tried to submit an assessment that already had been submitted. So this, if I was getting this in my facility or my agency, I would be saying, I probably have an issue here with a system for tracking, right? I don't know what I've already submitted because I'm trying to submit it again. So I'd be looking at this to identify what's going on from a process standpoint. With this error, if it comes back, and maybe you get this error and it's because you meant to actually modify a record that was already in there. Maybe you realize there was an error in a previous record and you're trying to just replace it. Remember, it has to be an actual modification. You can't be just replacing it. So again, investigate why this happened. And if it's a workflow issue and it's something that's happening on a repeated basis, you want to address that. It's about 400,000 instances in those first 9 months. The next record, or the next error is 909, and this is inconsistent record sequence. And this also is a warning message. And when you think about this warning message, think about it kind of a couple of ways. You may have this because you had a record that was submitted after one that logically came first. So you've got that start of care being submitted after a resumption of care, that example I gave before. But you also might be getting this error because a record was submitted without the record that you thought which logically makes sense would be there. For instance, you submit that a resumption of care, but there never was a start of care. So you're going to get this error because the system's basically saying to you, wait a minute, I thought I'd have something else before what you just sent me, okay? So when you're getting this error, you're looking to say, what's the reason? What's exactly driving this? Is it because I didn't submit something that I thought I submitted? So this is kind of an opportunity to look back at that as well. And again, it's workflow, it's systems with this, okay? One thing I do want to mention as you're going back and validating things like this, inconsistent record sequence, you know, if you submitted the start of care, you're going in submitting the resumption of care, you get this error back, and in investigating it, you may find out, wait a minute, I erroneously created a brand new patient in error somehow. You know, this is when you're going to be reaching out to those OASIS automation coordinators. So think about that this error that seems pretty simple can have a lot of potential causes, so be sure to really investigate. The next one is an invalid HIPS code, 4820. And this slide has been updated as well. And this is a warning message. And it is a software error, potentially. It may or may not be a software error, okay? You may need to report this to your software vendor, but you may not. So let's talk about how you know whether it's a problem or not. The HIPS code and the HIPS version code don't match in this error. That's what's caused this. Now the HIPS, those don't match the HIPS values that have been created by the system. So the kicker here is if the therapy need in M2200, if the therapy need is not applicable, the HIPS code or HIPS value isn't calculated. So you need to report this issue if the error occurs and therapy is anything other than NA, so you have any amount of minutes, this is a problem. But if it's NA, it's not, okay? So if the therapy need is NA, no action is going to be needed here, right? So if no therapy's in there and you get this error, it's fine. But if there are minutes of therapy or therapy need noted, then you've got to address this with the vendor. And I'm sure you're thinking, how can I possibly remember all of that stuff, right? The good thing is it's all written down in the manual where you can just go through, look up the error code, look up what the error means, and the actions of what you need to do for every single one are listed there for you, okay? Our next error, the sixth most common error, is record timing invalid. And this is, there are some record timing invalid errors. They're warning messages, and these, again, are workflow issues. These are something that the system, in order to ensure timely completion and timely submission of the records, isn't quite as tight a system as it should be. So this warning is indicating that the submitted record does not satisfy CMS's timing guidelines for follow-up assessments. So this one is particularly related to follow-up assessments. And it's basically saying that it didn't comply with the requirement that it's going to be on or after the 56th day and on or before the 60th day. So it's saying that it doesn't align with those rules. Again, you're going to be looking at systems with this, making sure that the system is intact regarding those follow-up assessments. And then the seventh most common error is 3320, inconsistent dates. And this indicates that, this is a warning message, and it indicates that the assessment was not completed within the CMS timing guidelines. Specifically, the reason for assessment was 9, discharged from the agency, but the date the assessment was completed isn't less than or equal to 2 days from the date that that person was discharged. So there's not that timing requirement wasn't met. So no action is needed on the particular record, but again, you might need action on a system-wide issue. And, oops. Our next record, or our next error, record 8. This is a fatal error. And you can see it's almost 80,000 occurrences of it, but the home health agency's identity doesn't identify with a valid provider. So this is an error in recording the number. And again, it's going to be kicked back to you. It is a fatal error, and you're going to need to update that, make sure it's correct, and then make sure that your vendor is involved. The vendor needs to help you correct that. And the ninth item is that an item that is required, hasn't been completed in the system. Again, it's a fatal error, probably a software error, and you're going to need to be in touch with your vendors with that as well. And the 10th error, I mentioned this one or alluded to this one earlier, and this is a value 3060, invalid value. And the value submitted for that item is not an acceptable value. And this is that example I gave earlier where the acceptable answers are 1, 2, and 3, and you submitted a 6. Well, your software shouldn't allow that. So again, involve the vendor in that. So my question, I have a polling question for you. And I'd like to have you, let me go ahead and start the clock. What is the number one error message for OASIS records? Is it invalid HIPS values, duplicate assessment, inconsistent dates, or that the record was submitted late? And almost all of you got it right. It is that the record is submitted late. So this to me highlights an opportunity for your action plan. Hopefully it's all the other guys and none of you that are having this error come back. But you may want to put in your action plan to head back to the agency and check into this one a little. Okay, let's switch gears and look at what I think is kind of fun stuff, and that is the quality reports. We're basically going to spend the rest of our time together, another 45-ish minutes, looking at the quality reports, and there are a lot of them available. And we really can start by taking a look at this graphic and looking at kind of how the reports that are made available to you support both public reporting and compliance. And you can see where there's CASPR reporting, public reporting, confidential reporting, compliance. I would kind of put a big giant circle around this whole graphic and write in it quality improvement, because I think all of these reports are tools that you guys can use and your agencies can use for driving your quality improvement. There's so much information that's made available to you through these reports. We're going to examine all of them. Actually, the next few slides we have list all of these reports. I do want to mention in the left, let's see, it's your left if you're looking at this slide, it says provider final, sorry, bottom right. It says provider threshold reports. Those have been renamed the quality assessments only, or QAO reports. So it's the bottom right green box there, not the left. So before we get right into those reports, let's talk a little bit about public reporting and what's available with public reporting. There's two public reporting platforms that are noted here on this slide. The first is Home Health Compare, and that's available on the Medicare.gov website. How many of you have been to Home Health Compare? You're looking at your neighbors, right? Yeah, that's what we do, right? It's for us and it's for the public. It's for lots of folks. So it is available at Medicare.gov, and I'm sure that's, based on the show of hands, quite familiar to many of you in the audience. You may, oops. Sorry, I had my slides out of order. I apologize. My notes in your slides, so I'm gonna go to the right slide now. Sorry about that. So with the reports here, we're gonna look at a few categories for kind of a better word categories of CASPR reports. The first are on-demand reports, including the quality measure reports and the review and correct reports. We'll also look at provider preview reports that are distributed to your folders. And I've mentioned to you this CASPR reporting user's manual several times. It is available there on the website, the QTSO website. It's an invaluable resource. Doing trainings for some other settings, when I would talk about the actual assessment tool, folks were very aware that there was a manual for that. They very often weren't aware that there were these other manuals that kind of support the whole process that surrounds that assessment tool. So please do get in and use those. And here is what I started to tell you about with the quality reporting. So the public reporting. The Home Health Compare, again, many of you are familiar with that, but that little bit less familiar tool that's available is data.medicare.gov. And there you can find the data sets that are used to actually populate the Home Health Compare website. So there's tons and tons and tons of data that are downloadable in various forms that are available to you from that website. If you haven't been there, check that out. It's kind of neat. And then we're also going to talk about the quality of patient care star rating, provider preview report, and the quality assessments only report, including the interim reports and the annual report that aligns with that APU. So the quality measure, or QM reports, may be referred to by some folks as the CASPR reports, CASPR user requested reports, and they do meet the requirements for confidential feedback reports under the IMPACT Act. The QM reports are available at both an agency level and a patient level for single reporting periods. When you're running these reports through the CASPR application, they're going to default to the most recent data available. However, you are able to select different time frames, data collection periods that you'd like to run. These reports are available on a monthly basis and are useful to identify potential data submission errors that may impact the quality of your agency's QM data, as well as in quality reporting. To me, these are in quality improvement and quality assessment opportunities. To me, these reports are really foundational, I think, for data-driven QA. We are going to review all of the reports that are listed on this slide and the next, and these are your on-demand reports. So we're going to look at the risk-adjusted outcome reports, both the 2 and 3 bar version, the potentially avoidable event report, and we'll look at the patient list as well as the 2 and 3 bar versions of this, the all patients process quality measures report and the 2 and 3 bar versions of that, the agency patient-related characteristics report, again, 2 and 3 bar versions of that. So what's the difference between these 2 and 3 bar versions that I've mentioned? The 2 bar shows your results plus the national average. The 3 bar gives you your results plus the national average plus a prior reporting period. And I'll show you an example of the Home Health Agency Trend Analysis Report and of the Patient Characteristics Analysis Report. We'll look at the outcome tally report and the Home Health Agency process measures tally report. And finally, I already mentioned to you the patient-related characteristics analysis summary report. We'll also look at the patient's related characteristics 2 and 3 bar reports. So tons and tons of reports available to support you guys as providers. So let's take a look at the first one. And I do want to mention to you that you can see these sample reports as well in that manual that I mentioned. There's samples of all of them there, so I recognize that they're difficult to read on a screen, or if your slides are full page, you probably are able to see them pretty well, but smaller slides are a bit difficult. So this report compares in a 2 bar chart the home health's mean values of approximately 250 patient-level characteristic items, and it compares those to the national reference sample for a specified period. So right up at the top of the report, it says reported current period, actual current period, so it gives you the dates. Requested current period and actual current period. So it puts in the dates that you asked for and the dates that are actually in the report. So if you're putting in specific times that you're requesting, just verify up there what's actually being returned to you. You can see the number of cases that the agency had, and then below that is the number of cases that are in the reference sample, and that reference sample is going to be that nationwide reference. And then you will see information about your patient characteristics, and these include lots and lots of characteristics: patient history, general health status, care management, their skin status, activities of daily living, lots and lots of information there. And this patient-related characteristics report is also available in the 3 bar version. And this report includes that information that I just mentioned, as well as including a prior period for your particular agency. So it's not a prior comparison period, but a prior for your agency. And again, the actual dates, the date that was requested and the actual date that is provided in the report is going to be listed there, as will the number of cases in the different time periods as well. So it says number of cases for the current and for the prior period, and then you'll also see the number of cases that's in the reference sample. Right, and next is the Agency Patient-Related Characteristics Analysis Summary Report. And this report summarizes by outcome measure the average percentage achieved, not achieved, and the differences between those values for about 40 case mix categories. For this report, when patients that are considered achieving the outcome is the number of patients achieving or triggering the measure, okay, is what's going to be reported there. Again, the date range is going to be listed there in this report on the top right corner again. Next, we come to the risk-adjusted outcome 2-bar report. And this report provides end result outcome measures, utilization outcome measures, and claims-based outcome measures separately. A page break is actually going to occur between each of these three types of measures, and the requested and actual time periods are again, that are associated with the report, are again going to be noted there. The report that's on this slide is just a portion of this report. And one thing I want to point out to you is the column in the middle that it says SIG NIF period. So this is the significance levels. And these are provided for each measure in this report when the sample size is at least 10. So you have at least 10 residents. There are footnotes on the bottom of this report that really help providers to understand what the values mean in light of your own data. And the idea is these numbers are going to help you to determine whether whether the rates that are reported here for you are really statistically significant, or if they're more likely due to chance. So they're going to give you these additional pieces of information to really help you be able to understand kind of what's beneath those numbers. The bar graphs here, I think, are great visuals that really allow you to see how does your agency really stack up to others. But again, do take a look and really take some stock in those significance levels. I think that they're a really important piece of this report. And then next we have the 3-bar version of that report, and it's very similar to the 2-bar we just looked at, but it compares those measures at the agency level to the national period reference standard as well as the prior period for the agency. And it's important here to refer to that CASPR Reporting User's Guide for specifics about which episodes are used in calculating the measures that are included in this report. For instance, the end results outcomes are computed only for episodes of care ending with a discharge to the community, whereas utilization outcomes are going to be computed for episodes of care ending with a transfer to an inpatient facility or a discharge to the community, and the claims-based measures are calculated based upon the episode begin date. So while you're looking at the same periods of time, you're really looking at probably different numbers that are going to be in the, different sample sizes and things like that. So understanding really what's going into these measures is going to help you to then use them in a meaningful way. There are about 40 measures reported on this report, lots and lots of information that's available to you. And next, we'll look at the potentially avoidable event patient listing report. And this lists each of the 12 potentially avoidable event measures, statistics for each, and the patients who experienced those events for a selected agency during the specified time period. And then the risk-adjusted potentially avoidable events 2-bar report provides the mean measure rates for the agency's patients with episodes of care that ended in a specific period and compares that to the national average. The report includes 12 potentially avoidable events, and they are each reported separately with a bar graph provided for each. And like the other reports, there also is a 3-bar version of this, and that does add the prior period for that agency, for that data. And again, you'll notice the dates that I've mentioned before. Again, they appear on most of these reports, the requested current period, requested prior period, what the actual current and prior periods are, and then the number of cases that are in the current period, the prior period, and that reference sample as well. So that information's in the heading up in the right corner, and then all of the data about your agency and the comparison are down below that. Next, let's look at the all patient process quality measure report. Here's the 2-bar version of this, and the report provides the number and percentage of each process quality measure for episodes of care that ended during a specific period of time, along with the national average. Oops. And there's also a 3-bar version of this, and that includes that prior period's data. Again, the date ranges are there, the number of cases up in that upper right-hand corner. And then we have the agency patient-related characteristics case mix tally report. And this lists each individual case. So each individual patient is going to be listed here up to a limit of 5,000 patients. It includes patient characteristics in several categories. There's patient history, general health status, living arrangement and assistance, various clinical categories, and more. And there's Ys and Ns in this report. A Y indicates that the characteristic was present for the individual. An N indicates that it was not present. And a dash indicates that the data were not available to let you know whether that was or wasn't present. There also are going to be some instances of numeric results printed back in this. For instance, the number of pressure ulcers or a patient's age. Those are going to actually come back as the numeric results rather than the Y and N. So you can see in here how this is, you can take those agency level reports now and now kind of dissect the data, right, at the patient level to say who's going into this agency level report and making my number this percentage of whatever characteristic I have. This allows you to drill down and figure out what's going on at the individual patient level. The outcome tally report details the episodes of care that ended during a specified period that were used to calculate the outcome risk-adjusted reports. So again, this gives you the cases that went into those reports that you're able to interpret at the agency level. Oops. And there's also one for the process measures. So the Home Health Agency process measures tally report details the episodes of care that ended during that specified period that identify the process measures that were triggered. So it allows you to take a look back and say, who went into triggering that particular rate for those measures that appear in that other report. And then finally, for the on-demand reports, we have the Home Health Agency trend analysis reports. And although my personal preference probably doesn't matter much, I have to tell you from a quality improvement standpoint, I love trend reports because these allow you to look over time, to say we changed our policy for something. And look, the change in our policy corresponds with a change in our outcome data, right? It allows you to say, are things that you're doing from a quality improvement standpoint impactful? Have there been changes in processes or in how, changes in operations overall? And look, we've had a downtrend or we've had an uptrend in something going on. So trend reports give you a real picture of what's happening with that particular measure. So these provide information for a 12-month time frame, and they give you the actual outcome-based quality improvement versus the risk-adjusted rates and the state and national rates. The percentile ratings are also provided. They're not shown here on the graph or on the screen They're not shown there on that report, but they are presented on the bottom portion of the report for you as well. So again, you can see the trends. You can kind of look back over time and say, what happened over time that changed, that led to these changes in our outcomes? So valuable reports, I think. Okay, let's talk about review and correct reports. These are new, and they are new confidential reports that will be made available to providers beginning on or around April 1st, 2017. So right around the corner. And these will contain agency-level QM data for OASIS-based measures, and providers are going to be able to obtain the performance for quarterly and cumulative performance rates. Eventually, these reports are going to contain 4 quarters of data, However, when they first roll out and become available to you, there'll be kind of a buildup of the data. So when they first come out in April, you're going to have one quarter, just quarter one of 2017 will be included there. Then 3 months later, you're going to have Q1 and Q2 of 2017. Then 3 months after that, sometime around October, you're going to have the first 3 quarters available. And by the time January 2018 rolls around, the four full quarters of data will be made available. Then April, we're 5 quarters into this, so that's when quarters begin to drop off. So it will be a rolling 12 months or 4 quarters, 12 months of data that are available to you. So the older quarter is going to kind of drop away as you go along. These reports will be user-requested reports that can be run as the agency wishes, so you can run them as often as you want. The report submit request screen in Casper will have a report end date field containing available quarters for the user to select. It will default to the most recent quarter. So you would be able to go back, and if for some reason, once other quarters become available in the report, you would be able to go back to a prior quarter if you wanted to. With the idea of these being reviewing your data and correcting, these are actionable, timely reports that allow you to really ensure the accuracy of your data. I'm not sure how useful prior quarters are going to be. I mean, you're going to probably want to be working with that current quarter. The calculations for these are going to be updated weekly until such time that the quarter is frozen. So when that quarter is frozen, then the report is what it is. You're not going to be able to, you won't see any changes, but you should be able to see updates from week to week. So if you went in and submitted last week, that data is going to be made available the next time you run that report. So they're really real-time reports. And here's just a sample of the report. And notice here, there are 4 quarter scores, and there's also the cumulative score. The cumulative, you'll see Q4, and at the top, Q3, Q2, Q1, and then the cumulative actually gives you the date ranges as well of that report. It tells you in the column whether the reporting period is open or closed. So you really do know, are you able to take some steps to impact the accuracy of that data that's in there? The number of episodes that are included in that reporting period will be noted there. And then again, the cumulative number of episodes will be there as well. Okay, so it seems to me like it's going to be a pretty useful report where you're able to go in and really make some actionable steps from it. All right, provider preview reports are also available on a quarterly basis for all home health agencies, and these contain agency-level QM data for the process and outcome measures as well as the claims-based measures. These are automatically generated reports, and they are saved into your agency's shared folder that I mentioned earlier. They're available about 5 months after the end of each data collection quarter, and that allows for basically the correction period to be over, and it actually allows time to generate the reports as well. I do think that this is a slide that may have a change from the previous slide. I think the final bullet there, I'm not certain, but I think the final bullet had a minor change in that, so you may want to just compare that. I mentioned that these are generated after the data correction period. As such, the data in these reports can't be corrected once they're made available. Rather, the corrections need to be made prior to the quarterly freeze date, approximately 135 days after each quarter. These reports are available to providers 30 days prior to the data being made publicly available. And there's an example of the provider preview report. Again, the header information looks very, very similar to the header information on the top of a final validation report, information about your agency. And then we look at, in the actual body of the report, is the process and the outcomes measures, the claims-based measures. It includes the agency's averages, the state averages, and the national averages for all of those. So this is going to be giving you a glimpse of what the what the public is going to see. And then there's the quality of patient care star rating provider preview reports, and these are also made available to providers automatically. These are saved into the provider's shared folder in the Casper application, and providers have about 2.5 weeks to review these data and then request submission of the rating based on documented errors in the data submitted. The rating in the report is the rating set to appear on the next refresh of Home Health Compare. And let's take a look at the report just a bit. We've got a few slides kind of with chunks of the report to show you here. In the heading of the report, the date ranges for the claims data and the assessment data are provided along with the star rating. Right below what you see here, you'll find the month and year the rating will be displayed. Then information about the ratings is also going to be made available, as well as information about how the ratings are actually calculated. If you continue down through reading that report, you'll come to information about how to request a review of your star rating. So if you look at something, you say, no, I have documented data that this isn't correct. There's information in this preview report that tells you how to take action. Remember that there's only about 2.5 weeks to do that. So this needs, there needs to be timely access to this report, timely action on this report if there's a concern that you have. The preview concludes with a rating scorecard that includes your agency's scores on the individual measures and the decile ratings and corresponding score ratings for them. This can be very helpful to you to understand your performance on each of these 9 measures, as well as understanding how that overall quality rating was created. And the report concludes with your quality of patient care star rating. Okay, so that basically those several slides we looked at were kind of the top down through the bottom of the report, but kind of missing all of that info that tells you how the ratings are created and how to request that submission should it be appropriate. All right, next are the quality assessment only, or QAO reports. And these reports alert agencies of their status toward achieving compliance with the OASIS quality data submission requirements. Specifically, they note your compliance with the requirement that there be those matching assessments for each patient admitted to the home health agency. The compliance threshold is that 70% threshold, and there are interim reports available on a quarterly basis, as well as an annual report that aligns with your APU determination period. These reports are automatically generated reports, and they are saved into your agency's shared folder. More information about the reporting requirements, including the types of OASIS assessments that meet the requirements, are on the CMS website on the Home Health Quality Reporting Requirements webpage. So if you go, actually, you could use a search engine or whatever and put in Home Health Quality Reporting Requirements, and that will bring you, you can find that page. That's the actual title of the webpage. A lot of information there on those. And these reports begin, we'll look first at the interim report. It begins with providing the agency with their score and a notation of whether or not the agency would meet the compliance threshold. Information is then provided about the home health QRP, how the compliance threshold is scored, and a bit of additional information that follows along. Then you come to the final page of this report, and in the final page of the report, it details the number of assessments of the various types, and it notes the number of those assessments that do or do not meet the quality assessments criteria. So you can see the total number of quality versus non-quality assessments here and really understand how that QAO score is then created, and that's that final cell. Sorry about that. Final cell that's down there at the bottom. And again, there is information that's available with this report that really helps you to interpret what's in each one of these cells to help you understand what the data really are telling you. Oh, what have I done here? Sorry, I'm having a clicker problem with all these reports with the same name. I apologize. The annual report, again, the information in the annual report closely aligns with your interim QAO reports. It looks very similar. The annual QAO reports were posted to the Casper folders at the end of September. So these show the QAO results for the APU period of July 1st, 2015 through June 30th, 2016. These reports are only going to remain in the folders for 120 days. So if you haven't been in to get those reports, make sure that you're accessing those and taking a look. And again, the lower portion of the report, again, you guys saw this slide a moment ago, looks very similar to the interim report. With these reports, there are some sample reports that are available online. So in addition to your actual reports, there are some samples there that you can use for staff training and things that are available on the website I mentioned. So I want to spend the last couple of minutes that I have here with you with talking about some changes to report retention for Home Health Compare preview reports first, and then some other changes that are coming in the coming months. So the retention period is decreasing for the preview reports from the preview reports, from 730 to 90 days. And that's effective January 2017 with that distribution of the reports. So reports that have been able to just sit in there for months and months and months, that's not going to happen as of January. At that time, all previous preview reports will be removed from the share folder, and your agency, when you receive that January 2017 report, that will be in that folder for 90 days. Okay, and then again, it'll be gone with that refresh. There are other changes that are going to occur. Some of these timelines have not yet been established for or been finalized for. Any that they have been finalized, I'll certainly mention to you. You saw yesterday that 34 measures will be removed from all reports except the tally reports. And new Impact Act measures will be added to the respective preview and on-demand reports. When you think about confidential feedback reports, think back to that graphic that I showed you earlier with all of those little boxes indicating the reports. And there was that one section labeled confidential reporting. And in there were the QM reports, the review and correct, and the provider preview reports. All of those are going to have that information added, the Impact Act measures added in 2017. The Impact Act requires that providers are able to see their data prior to it becoming publicly available. And providers already have this capability with your on-demand reports that I had discussed earlier, including the tally reports where the patient-level information is provided to you, and the 2 and 3 bar agency-level reports as well. The Impact Act measures will be included in these effective January 1st, 2018 is the date for that. So I'm going to leave you with a final question, and that is a polling, and that is the retention period within Casper is changing from 730 days to blank days effective January 2017. I hear lots of 90s. Thank you guys for staying awake. It was a very robust 90. Great job. I want to just leave you with resources. Please, if you haven't been to QTSO, check it out, the qtso.com. And there's also, believe it or not, a QTSO help desk where people who are absolute experts in all of the technology around submission and getting those reports and all of that are available to help you. And with that, I'm going to ask if there's any questions for me or for my colleague Julie, who's been patiently waiting on the phone for us. If you do have a question, I welcome you to come to the mic.
Hi.
Hi there.
I'm Thelma Bowen. I'm from Healthcare Compliance Services, and I have a question related to the OASIS error reports.
Okay.
I'm not sure if it's related, but I thought, well, I'll throw it out. So what error, I wanted to know what OASIS errors do surveyors target when they're preparing for survey?
I don't know the answer to that. I don't know if we would cover that in the scope of this training. I think that that would be a question I would refer you to your state agency, and they could provide that, the actual surveyors, so the survey insert would provide that information. Okay?
Thank you.
Yep. Any other questions?
Adora Nora, KOC Healthcare.
Hi.
I'd like to know which of these errors affects the 2% deduction.
Which of the errors are with the 2% reduction? The issue with the, someone from CMS, I'm sure will talk more about the compliance threshold, but the compliance threshold isn't with accuracy of your assessments, it's about having the matching pairs of assessments. It's about having those in there. Joan, is there anything you want to add to that, or? Yeah, they'll address your question more, but it's not about the error codes. It's about the data being submitted as required. Any other questions? Okay, I think Mark is going to come back up. Thank you all very much. Appreciate your attention.